We are in the midst of a war, a crisis that has only grown within the past 20 years, an epidemic that has plagued generation after generation. This war has been declared upon ourselves. The mental health crisis is profound, as cases of depression have spiraled, with answers yet to be explained. This rise is exemplified by the increased use of antidepressants. The Pharmaceutical Journal recently reported that antidepressant items prescribed over the past 6 years have increased by 35%, from 62 million to 84 million. The pharmaceutical industry has made enormous profits off this threat without offering substantial solutions. The solutions aren't ineffective, they just aren't alarming. Depression has long been thought to be an incurable disease that has been treated palliatively. Antidepressants are designed to abate symptoms and not root causes. It's like using Band-Aids to limit the bleeding when stitches are needed to stop the flow. Daily treatment for depression is nothing compared to a potential cure. The symptoms of depression are difficult to understand, nonetheless its root causes. Yet depression is the #1 cause of disability globally. Treatment is entirely relative to the patient. One overarching pill will never cause or cure the majority of cases. These antidepressants can also lead to dependency, a dependency that only numbs suffering rather than confronting it. But there is a non-traditional and controversial therapy. A confrontation of trauma through altered consciousness has repeatedly shown resolution. Administered psychedelics through guidance and structure offer this shift in perspective. Take, for example, therapeutically administered psilocybin, or magic mushrooms. When used in a supervised setting, patients have identified visiting past trauma, gaining healing insights about their life, or experiencing euphoric harmony, connection, or unity. The practice connects a disconnection from ourselves. The default mode network houses the self and the assumptions about the self. It's basically our ego. The psychedelic challenges this defense mechanism by opening inactive neural pathways throughout the brain. Emotional experience lies at the root of this historically sacred practice. This, when monitored and explored correctly, this therapy is incredibly beneficial to the patient. When taken impulsively or dosed incorrectly, psychedelics can have serious consequences. It's difficult to harness the power of such a mind-altering drug without guidance. The careless use of such a powerful drug can lead to catastrophe. Maybe psychedelics shouldn't be recreationally legalized. However, we cannot polarize drugs based on recreational use. It's much more complicated than that. With great power comes great responsibility. How should psychedelic treatment be practiced nationwide? Let me introduce medicinal mind treatments. Prior to the ceremony, patients would be required to complete a month of psychotherapy, including spiritual preparation such as microdosing, meditation, and spiritual yoga, along with structured therapy sessions. The ceremony would include a 3-to-1 therapist to patient ratio, as patients would direct the conscious content, while therapists would offer spiritual guidance. A recent study at Johns Hopkins regarding this therapy stated participants had stable rates of response to the treatment and remission of symptoms throughout the follow-up period, with 75% response and 58% remission at 12 months. The mental health crisis is in desperate need of solutions. We must explore all solutions to potential remission. You can take action by donating to medicinal mind treatments nationwide. These centers offer a variety of natural and spiritual treatments, importantly exploring the therapeutic nature of psychedelics. As Timothy Leary once said, "Turn on tune in, drop out. Thank you very much.